So Brennan's right, ultrasound is absolutely a tool we can use when we're looking for pneumothorax. And what we want to see is the visceral and parietal pleura sliding against each other. It's shiny, looks like ants on a log. All right, my partner's actually going to let me scan them so I can show you guys. So top pointer goes to phallic. All right, and then we can see in real time. Take a deep breath, Chris. You can see his pleura sliding against each other. You can actually do this at any point on the chest. And then as Chris breathes, you can see the A-lines, and that's actually just like a reflection of what you're seeing at the top. It's pretty much healthy lung tissue. Okay, so a positive slide sign means that our pleura are rubbing against each other and that our lung is inflated. What is the opposite? So that would be absent lung slide. So if you look at the line down here, you can see there's nothing moving, there's nothing sliding. It just looks solid. Sometimes you catch this, and this is lung point, and it's the actual point where you see the separation between healthy lung tissue and where the visceral and parietal pleura are separating. However, one thing to keep in mind, the presence of the lung slide is almost 100% indicative that you do have an inflated lung. However, the absence of lung slide is not 100% indicative that you have a pneumothorax. It's a pretty good indication, so we need to use that in conjunction with the other signs and symptoms that we see. Here's the kicker, and it's actually, this comment is what made me think of it. When you first assess somebody and you see that lung slide is absent, and you assess and you decide they have a tension and you decompress them, you can't go to look again to see if you have lung slide or not. It's not typical that that lung slide is going to be restored in the time that you've decompressed and made it to the hospital. So once you lose lung slide in the presence of a tension, you probably won't get it back right away, so you can't use ultrasound again to see if you've retensioned. And that's where the other video comes in handy. That was certainly a lot of information, and hopefully something helped.